Hello, everyone. My name is Reema Kadri, and the title of my presentation today is Oversampling Won't Save You: Fostering Representation and Fair Access in Health Research Design and Implementation. And I want to stress that in each way, this title does reflect the content of what we're going to talk about today. So keep in mind, we're talking about fostering representation and fair access. And it is about design and implementation for the research that folks are doing. All right, to my next slide, if I can do this properly. All right, so who am I? My name is Reema Kadri. My pronouns are she, her. I have a master's in library and information science, and I work as a research area specialist in the Department of Family Medicine. And I also have effort at BRISP, or the Behavioral Research Innovation and Support Program out of MISHAR. And that's one of the coolest part of my jobs is my day job is managing clinical trials and helping to build them and doing really neat stuff with humans and their data, but also in consulting with teams across our entire research enterprise related to doing research with humans and their data. So even if it's not my project that I'm maybe talking about today, it's lessons learned and observations from other people's projects. And so that's who I am, but who are we? And I want to start with a quote from the late John Lewis. Do not get lost in a sea of despair. Be hopeful, be optimistic. Our struggle is not the struggle of a day, a week, a month, or a year. It is the struggle of a lifetime. Never, ever be afraid to make some noise and get in good trouble, necessary trouble. So today's conversation, why are we having it? It's because diverse participation ensures generalizable results. Methods to promote equity ensure all participants are sharing both the benefits and burdens of research as defined in the Belmont Report, and this is the section specifically on justice. An inclusive design will lead to stronger recruitment and retention of participants, which should ideally ensure your end of study outcomes reflect your diverse target population. That's why we're doing this. It's better science, and it's something we've believed in for a very long time. So how do we do it? My approach is to ask 5 questions, but I don't ask them once. I ask them every single moment, as it were, but at least at big milestones in our projects. And this helps us foster that representation and fair access in health research. And you're going to ask them when the grant is being written. Literally, you're going to ask it as we're sitting down at the table. We've got a whiteboard, we've got sticky notes, and we're thinking, what is it we're going to try to do? When we're putting together that IRB submission because someone has said they're going to give us money, how do we represent to the IRB that we are taking our participants into consideration? The study prep, all of the lead up, all of that hurry, hurry, rush, rush, wait, wait, hurry, hurry, rush, rush that you would do, the launch of the study, at the point when you're seeing your initial recruitment numbers and you're seeing some of your initial data, you're going to ask these questions. You're going to ask it throughout, not just when the data first starts coming in and you're looking pretty good. You're going to keep asking these questions. And at the end of study, you're going to go back to these questions and you're going to say, is this explain what we're seeing? Or how do these 5 questions explain what we're seeing? And all 5 questions start with the same words. Who are my participants? Everything we're doing, right, when we're talking about research, is about people. That's what I'm talking about. And so, who are they? So, number 1, who are my participants and how are they reflected? And I can't stress enough how challenging it can be to reflect our participants in the world we live in. Here's some examples. Many years ago, when I first started here at the University of Michigan, I was brought on to work on a R01 where we were recruiting Black folks out of the emergency department in Detroit area hospitals. The entire intervention was designed for folks with hypertension, high blood pressure, who were Black in Detroit. We were building a mobile app that included photos and videos. Back in 2016, when we were trying to build this, it doesn't seem that long ago, it was impossible to find photos of Black people exercising, eating healthy, and taking their blood pressure to be used in this app. We had to literally comb the internet to find them because all stock photos were white people. And that literally was not our demographic. That wasn't our cohort. If you would like to add in diversity in ages, diversity in disability, diversity in technology usage, again, who are our participants? They are folks who are Black, who are trying to exercise and eat better because those are the behaviors we wanted to encourage, but I literally couldn't find photos of it. So that's only one aspect of your participants and how they're reflected. That's just one example. The another example obviously is related to disease condition itself. If you have a research study where participants are being encouraged to walk, for example, like so much of our work, but I'm also doing work with a population that is older and may need assistive devices. Can I find images of people walking with walkers or canes or people who, may obviously be older or less, uh, or more likely to be infirm, as it were? So again, how do I see them? How do I show them to the audience that I'm trying to pull in to my research? And then what other conditions of this population, even the materials you're using to interact with them, what other aspects of their experience are relevant? An example, we were trying to have an intervention that was as just as appropriate, whether you were living in an urban area or a rural area. One of the eligibility criteria in order to ascertain whether someone was safe to walk was a question about whether or not they could walk a block. But my rural participants had no idea what a block was. What is a block? Literally, by asking a question to ascertain safety, we were already confusing and therefore possibly discouraging our rural participants from even participating. We then changed it. And that's the whole point of asking these questions and thinking about these things is what does a block mean? Well, we ended up saying, can you walk for 10 minutes without stopping? That was kind of a good metric. Isn't that just as useful as asking what a block is? Um, Also, again, what is your population? Who are they culturally as well? For the project that it involved Black folks in Detroit, it was hypertension. We also had folks who were logging their food. But so many of the instruments related to food logging and high sodium were foods that this population would not necessarily eat, but didn't include foods that this population absolutely did. And so we ended up creating our own instruments for sodium logging to better reflect who our population was. So, who are our participants and how are they reflected? So, now, of course, we're here in the digital world. That's who we are as this group. Who are my participants and how are our technologies appropriate? So we're collecting digital data. Again, that's what DigitMI is here to talk about. So what devices do our research require. And we have to accept inherently that bring your own device trials are discriminatory. They are by default. Even when we want to rely on the belief that our interventions are stronger when they are seamlessly integrated with what people use in their everyday lives. So their iPhone 16 is their baby, and that's what they use every day. So we want to rely on that. And maybe their Android device that's super old is, again, that's how they get through the day. We want to rely on that device because that's the best uh, proof that our intervention can be successful. I get it, but that means everyone has to have a compatible device. And so recognize from the get-go there's a tension there. And if you have to rely on a bring your own device situation because that's what makes the most sense, make sure your technologies don't require the newest, greatest operating system. Make sure that they can go back as far back as possible. Boy, that adds to the expense, and I know it, especially when you're getting into the gazillionth versions of Android that are available. But it ensures that your technologies are appropriate for the biggest group of your audiences you need to. Um, Also, you need to be very aware of this, one of my favorite acronyms, and that is WCAG, or the Web Content Accessibility Guidelines. This is how we need to move forward in building everything we do. We need to be thinking about how do we make our technologies completely accessible to those with disability? How do we ensure that screen readers can read our content, that we have good color contrast for people who have different visibility, vision impairments? How do we make our content accessible to those with disabilities? The world is filled with people with disease conditions, with health conditions that we are trying to improve their quality of life, but they also may have disability. There is an outstanding group here on campus, the Disability Equity Office, who will do consultations on your materials, on your websites, on your mobile applications, and even on your PDFs. This presentation, I am sure, will not pass AA or AAA standards. That's on me for not getting it through him and doing a consultation with Phil Deaton and his group. I should have. I might go back retroactively and do it. But there are ways that we can make our technologies appropriate for the assistive devices that people need for disability purposes. Who are my participants? And how are we communicating with them throughout? I talk about this a lot, and I want to start by saying there are times, in fact, when sending a letter by USPS is the correct way to communicate with our participants, as much as it kills my soul, both as a tree hugger who likes to save money and save trees. But for some people, that is the way to reach them. That makes the most sense. But for some of my participants, that's going to get pitched. For some of my participants, it is a text message, and any other form of communication makes no sense. For some, it's still email. For some, it's all of these. For some, it's none of these. Sometimes it's in person. But who are your participants? I can't give you, the person reading, listening, watching this presentation in whatever format it may or may not survive in the future. I can't tell you the right way to talk to your people. You need to think about it, but how are you doing it? And it is, I will say it, I guess one rule is it's almost never what is most convenient for you, to be perfectly honest, because text messaging systems can be expensive and problematic and hard to incorporate in your workflow. So can letters, so can emails. So you need to figure out what makes sense for them. And it's not just at the start of the study, it's throughout the study. What makes most sense? How are you communicating for them? And again, sometimes it is in fact at community events. It is in public places. It is in wherever your group needs, you're more likely to find them. And then who are my participants? And have we right-sized our touch points? If we're talking about silver linings of COVID, which can still feel kind of hard, I still feels a little bit too soon to talk about that. But when we talk about COVID and its impact on research, one of the things that I celebrate is the fact that so often protocols looked at what it is they were doing in the era of COVID and said, gee willikers, why are we asking all of these questions to make these study visits, which are all being conducted by Zoom, so long? And do we really need all of these study visits to begin with? And we figured out that we could do a lot of really good work fully remote. And that is an important silver lining. And I think we need to continue to carry that question forward. Again, at every point in our research, have we right-sized when we are interacting with people? Whether that is number of study visits, whether those study visits are in person, whether we are asking too many questions because our study visits are becoming long and bloated. Again, whether it's in person or remote. Um, for things in person, remember travel time and just traveling can be a massive burden. Long study visits can be a significant disruption for your population if they are low income and they need to be at a job that doesn't have flexibility to just give them an afternoon off. For our folks who are disabled, again, just physically getting to your location for recruitment activities can be challenging. I say that as a caregiver myself. Um, Can you contact people? Can you interact with people via Zoom, via asynchronous means? Can you meet them at their local location versus bringing them to where it is convenient for you? Um, and when it comes to, again, right sizing our touch points and what we're doing at those touch points, don't collect data you don't need. Don't collect data you shouldn't have. There is data that makes our participants more vulnerable simply because you have it, and therefore the chance of a breach of privacy or confidentiality could lead to harm. Be very thoughtful about what it is you have. And I say that with great affection. I have worked with outstanding researchers where their surveys and their interviews are massive, and this trove of incredible data is resulting. We don't analyze a fraction of it. And I'll again say, what are you going to analyze? What does your protocol say you're going to analyze? And what you're collecting, do you need it? Or are there things perhaps you shouldn't, just knowing the vulnerability of your population? Also related to touch points, and this is a brand new conversation. One of those ways that we interact with our participants, that we touch our participants, is incentives. And I have a standing rule now for every single project I work on and I consult on. The going rate for me for any interaction with a participant is $50 minimum. No more of this $20. No more of a let's give someone a baseball cap and call it good. Um, with the price of eggs being where they are, $50 should be your minimum moving forward. On top of that, again, who are your participants when you are trying to pay them? I have a study that I'm actively consulting on right now. They are out of a state, somewhere in the central United States, where they are doing interviews with people who are using or misusing opioids, and a significant portion of their population is unhoused. How do we incentivize those interviews? How do we protect those people? How do we get them money in a form that is useful to this very, very vulnerable population. And a gift card with a lot of restrictions, a check that requires a bank to cash it, that's not fair. That's not equitable. And that will be a problem for this population. So, how are we going to do it? We're working on it. But the answer is we're going to work on it with the focus being on the participants and ensuring that they have just as much access to participate in this research and they receive the same benefit as anyone else would. All right, coming up. Who are my participants? And do we have the required credibility and trust? So at the beginning, I talked about this study out of Detroit. We're here in Ann Arbor. Who are we? And the answer is we're nobody. We are, of course, a bunch of really passionate researchers. We care a lot about this topic. We care a lot about this disease condition. We care a ton about the technology because I'm a big technology nerd. But at the end of the day, we are not much of anything to the participants who were being recruited in the emergency department, but our collaborators were. And that was Wayne State University. Our advisory board that reviewed our materials, that reviewed our intervention messages that were sent by a text, they had credibility, they had trust. The community events that we went to talk about the study, again, we were represented by trusted people, by folks who had credibility in the community. That matters. And if you don't have that credibility and trust with your population, that doesn't mean pack it up and go home. That means find the people to partner with who do and work with them. And you have to do it at the very beginning, not when things go wrong. As I said at the beginning, the title of this presentation is Oversampling Won't Save You. You can send out 10,000 letters. It doesn't help you if your letterhead means nothing to them. Or even worse, if your letterhead, in fact, raises red flags. So find the folks who you can work with, who help you understand your population even more, who can help bridge the gaps, who can help build that trust, and in fact, mitigate any historical mistrust that your population may have, whether it's with the University of Michigan specifically or with health research in general. And your materials can change over time. You can try to course correct some of these things midstream. I'm not going to say if you didn't do it at the beginning, there's no value to do it ongoing, but it's better if you do it from the start. And so let's talk really briefly about, because I said in this, who are your resources? These are your links. These are your folks to consult with. That's one of the great things about working here at the University of Michigan and in Michigan medicine is that we literally have folks who have direct links. They want to talk to you. They love talking about this stuff so much and they want to help you. So I'm going to put in the first plug, and this may be alphabetical order. It may, also be the fact that I work for BRISP, but for the Behavioral and Social Science Research and Innovation Support Program, or BRISP, that's literally what we do. We look at your protocol. We look at your research question. We look at your surveys, your materials, your informed consent, and we literally think about this both from a science perspective, an administrative logistical perspective. We bring our years of experience in doing this work and we talk through things to try to head off problems or address them as they come up. I want to, again, plug the Disability Equity Office. Phil Deaton and his team are incredible. These are folks that will look at your materials and again, think about them in terms of how your folks with disabilities might not be able to interact with your technology, your materials, your content. Um, it has been transformative for me to be part of some of these groups that are related to disability equity. Um, and it with this web content accessibility standards, it's not actually optional anymore. And we should be doing it because not only are we going to ensure equity in our recruitment and retention materials, but it's also pretty much law. And his office can help you navigate that. The Mishar in Community Engaged Research Group Consultation Service, again, they can help you with that. Who do I partner with? How do I build trust? They literally can help you find those folks. That even can include finding a advisory board or a stakeholder group or other groups that you can partner with. That's what they're there for. They can facilitate that. The Mishar recruitment and retention group, once again, beginning of your study, middle of your study, they can look at your materials, they can look at your approach, they can help you put your materials together in a way that tells the story of your participation in the study, reflecting your participants, keeping in mind how your participants are likely to want to see and interact with this. And then, of course, the mobile technologies core, because these are the folks who can tell you about some of your technology options. Again, recognizing some of the problems, pitfalls, whatever you want to call it, with any of this digital collected data and how we do it. It's not a perfect world out there. These devices are not always perfect. There may be some approaches you may want to consider. And of course, if you're me, you want to consider what is the least burdensome approach, both for your participants and for your study staff. And you would be in fantastic hands in that consultation environment. So these are your resources. With your 5 questions that all start with, who are my participants? That is how we can ensure that we are doing what is fair and representative of our populations, that our research can be stronger, that we have better results, that we have reproducible results, that we have defensible results. So, um, I'm a Slack user, big Slack nerd. I do also use Teams, but you can also email me. If you put in a consultation request for BRISP, you will undoubtedly run into me. But I am passionate about how we can serve our populations, how we can serve our researchers, how we can serve our values. And I am always willing to chat. And if there are any questions, I'd love to answer them.